Hey guys, my name is Dr. John Jazeri coming to you from San Clemente, California. In today's video, we're going to be comparing a root canal treatment to a dental implant. Here's what happens. You walk into the dentist, they take your x-rays, do your exam, you have a big hole on the tooth or you have an infection or toothache, and they're going to propose the options to you. One is a root canal treatment, and the other one is to take the tooth out and put in an implant. Which one do you choose? This may seem like a simple solution, but it is not. There are so many factors you need to consider when you're deciding if you should go with a root canal or we should go with a dental implant. And I'm going to go over all of those in this video and tell you exactly which one is the best option for you, your tooth, and your mouth. There's two kinds of philosophies people have. When patients come to me, some of them are like, you should always try to save the tooth. No, you shouldn't. If the tooth is going to fail in 2 years, why would you try to save it? Just take it out and do the implant. If the tooth is not in a position where I can actually give you good prognosis with a root canal, take it out. Don't waste your time, your money, and my time. Then there's other perspective where you should not do root canals. Implants last longer, they're permanent, so you shouldn't do root canals. Just take them out and do implant. That's not correct either, because a beautiful root canal can last for 10, 20, sometimes a lifetime, many years. So there's no reason to just start taking teeth out and putting in implants either. It really depends on a lot of different little factors, which I'm going to go over in this video, so you can make an informed decision to decide if you should do the root canal or if you should do the implant. And a lot of people think, well, a root canal is less expensive, so I'm just going to do the root canal. No, you should not do that. You should do that based on the prognosis of the tooth. And root canals aren't even that much less than a crown, because when you do a root canal, you have to do the post, you have to do the crown. A lot of times you have to do a crown lengthening, and when you add all those up, the difference is usually negligible, maybe a couple hundred or $1,000, especially with implant prices coming down. And of course, if you do that and your root canal fails 2 years later, then you've just wasted all your money. So you should not make this decision based on finances or based on what your insurance approves. You should make it based on the prognosis of the tooth and whether or not a root canal has a good chance of lasting 5, 10 years or not. So I'm gonna go over the criteria you need to look for in this video. What are those criteria? One of them is a condition of the tooth. Is the tooth is restorable? What are the prognosis of restoring the tooth? Another one is the tooth history. What's been done to the tooth in the past? Another factor that I always look for is if it's a chronic versus an acute infection. That makes a big difference, as I'm going to explain to you guys later on in this video. Another thing I look for is the previous luck that the patient has had with root canals in their past history. And then finally, the quality of the work makes a big difference. So we're going to go over the quality of your root canal and the crown and how that can impact the prognosis of your root canal and crown and whether or not it's going to last for a long time or for a short time. Okay, guys, so we got plenty of things to talk about. But before I get into all of that, I want to bring the attention of those of you who are looking for a dentist or looking to upgrade your dentist to go check out the website even28.com. That's even, which is EVEN, the number 2, the number 8. Even28.com, the dentist search engine. You can go to the website, browse through profiles of dentists, learn more about the dentist next to you. You can search based on zip code, based on city. And when you find a great dentist, you can schedule your appointment all conveniently online from the website Even28, the dentist search engine. So guys, go check it out and go listen to my video so you can decide if you need to do a root canal or if you need to do a dental implant. Guys, the first factor you should consider when deciding if it's worth saving a tooth or if you just say goodbye to it is how much tooth structure is left above the gum line. So that comes down to the restorability of the tooth, the ability of your dentist to restore your tooth. Here's what happens. When you break your tooth or when there's a cavity, you're gonna have so much natural tooth structure left above the gum line. And the more you have left, the better your prognosis. It's really that simple. Let's go ahead and take a look at some x-rays and some models so you can better understand what I'm trying to explain, okay? So this would be an example of a root canal that's done pretty well, right? I mean, you can see there's the root canal, there's the post, there's the crown. This root canal is probably gonna last the patient a very long time. And then you have the exact opposite here, this tooth. Okay, now I don't know what possessed this dentist to do this root canal and crown, but if you notice, there's nothing left of this tooth. So no matter how beautiful your root canal and your post and crown is, this thing's doomed to fail. I mean, this thing's only a couple years old and it's already coming apart and the patient already lost the tooth next to it. So how much tooth structure you have above the gum line is the most important thing. And if you're gonna listen and learn one thing from my videos. You need to have enough tooth structure to support the actual crown, because what happens is the material we put in to restore the tooth, right? So when you break the tooth, we can put posts and filling and build up and stuff. Those are not nearly as strong as your actual tooth structure, the enamel and the dentin. So if you don't have enough tooth structure above the gum line, don't save it. If you have plenty of tooth structure, then yeah, that's a good reason to go ahead and try to do the root canal. All right. The model. You know, a lot of people come to me with a front tooth broken like this. Let's go to our model. Like this, okay? So this is the root, and you break it right at the gum level, okay? This is very common to see with anterior teeth. You know, you have almost no tooth structure above the gum line, right? Because the gum line is this blue thing here. This is the root. We have nothing above it. Take it out. Don't waste your time and money. You know, if you go to an old school dentist, they're going to say, let's do a root canal, let's do a post, let's do a crown. This is what you're going to get. Okay, this has to come out and be an implant less than 2 years after the work was done. So if you don't have enough tooth structure above the gum line, the tooth needs to come out. I mean, if you're okay putting a crown and a post and spending thousands of dollars for something that's gonna last a year or two, go ahead, save it. I personally wouldn't do it to my mouth, okay? Let's go ahead and look at another model so I can better explain this, how it works. So again, this is where our gum line is, right? And if you break the tooth where the green portion is, so if you have about, let's say, 20 to 50% of the tooth structure left, that tooth is very much so savable. You should try to save it with a root canal crown. But if you break it and this is all you got left where the blue lines are, then that's, you know, that's when you start to really need to consider doing an implant over a root canal. And of course, if you break it at the gum line, right, which is the models and the pictures I just got done showing you, then you definitely want to gear towards the implant. So how much natural tooth structure you have is going to be a determining factor. Now, of course, if you have a cavity and you have all of your tooth left, then yeah, you should be okay with a root canal crown. But a lot of times when it's an extensive decay and it's going below the gum line and stuff, then your root canal crown is probably going to fail within a couple months, couple years. So you're just better off going the other route than sticking with the dental implant. So the first thing to take into consideration, and probably the most important thing, is how much tooth structure, doc, do I have? Do I have enough to support a crown to get 5, 10 years out of it? Or is there just almost nothing left, at which point you're better off going with a dental implant? Guys, and the second thing you want to look for when deciding between a root canal or dental implant is the tooth history itself. So here's what happens. Every single time your dentist works on your tooth, you lose a little bit more tooth structure. So whether I do a filling or a crown or a root canal, I have to remove some of the tooth structure. Okay, now what that means is over time, over the years and the decades, every time your dentist keeps working on a tooth, you start to lose more and more tooth structure. So the tooth gets weaker and weaker. Okay, eventually it reaches a point where the tooth just is too weak and it starts breaking, cracking, falling apart, and everything fails at that point, okay? So don't let your tooth get to that point. If you've already spent tons of time working on that tooth, do you really think it's gonna support yet another procedure? You know, patients come to me, they've spent thousands of dollars on a single tooth, and they're still wondering if you should do another root canal treatment. And the answer in those cases is usually no. Take it out, cut your losses, and just go with the dental implant. Okay, let's go ahead and look at an example of a situation like this. So patient comes, you know, she's done root canals and whatnot and crowns, and we took this x-ray and there's something here. So she came to me for a second opinion. And the question is, what do you do? Do you do a root canal retreat? Try to find that extra nerve, or do you just take the tooth and do an implant? Now, again, you know, my philosophy is you've spent enough time and money, lady, on this tooth, take it out. But of course, you know, we decide to go and take a CT scan. And this is what we see on a CT scan. If you can see the little black, that's all pus. And if you see it here, massive pus. And again, massive pus draining into the sinus. I mean, this tooth can basically swim in pus. There's so much pus around it. So yeah, when you reach a situation like this, when a tooth's been worked on so many times, it's usually not worth working on it one more time and attempt to do one more root canal or root canal retreat to try to save that tooth. What is the point? Even if you get a good root canal and you redo it, it's only gonna last you a year or two. And besides, when it's infected like that, that infection is not gonna go away. You can do root canals all day long. That abscess is already well spread into the jawbone. So when you get a situation where the tooth's been worked on many, many times, yeah, I tend to gear towards pulling the tooth. Now, on the opposite end, if it's the first time your tooth just cracked, those teeth are perfect for root canals. You're gonna get very good prognosis with a root canal. But generally speaking, the more the tooth's been worked on, the more I gear towards just not trying to work on it. Which leads me to why I prefer doing root canals and crowns based on age. Usually when I get younger patients, 20, 30, 40s, I almost always favor doing a root canal because, you know, that tooth's been in your mouth for a couple decades, not that long, and, you know, it hasn't been worked on a lot, most likelihood. So let's go ahead and try to save it. But when I get a senior citizen patient, I mean, think about it. You're 70 years old. That adult tooth's been in your mouth for 60-some years, right? Do we really think a root canal is going to buy us that extra 20 years that you need? You know, I hope you live to be 100 years old. But is a root canal going to get you a couple more years? And, you know, a lot of times the teeth are just too weak to handle that, and they're just not a good prognosis. So for senior patients, I definitely prefer implant, you know, all things being equal. And for younger patients, I almost always prefer root canals because, you know, the tooth is usually hasn't been worked on. So you want to look at a tooth history as the second factor when you're trying to decide if you want to go with a root canal or a dental implant, guys. Guys, the third thing you need to consider when deciding between a root canal treatment or a dental implant and pulling the tooth is whether or not the infection is chronic or acute. Acute infections are something that just happen right away. So you fall down, you break a tooth. The doctor drills your tooth, gets too close to the nerve, and now it's, you know, needs a root canal. Those situations are acute in terms of, you know, the infection or the cavity or the pain's been only there for a couple days, couple weeks. And then you have the opposite. You have a chronic infection. So that's when you have a bad tooth that's been nagging you, but you just, you know, for whatever reason decided to ignore it, and 3 years later you're going to the dentist to take care of it. So when you have a chronic infection that's been in your mouth for a very long time, usually doesn't respond well to root canals. Why is that? Because in those cases, the infection usually spreads past the tooth into the jawbone. And even if you get a nice root canal, the chances of it failing a couple of years later is extremely high. Remember the example we used previously, right? So this was the chronic infection, which, oops, Google, we don't need address, please leave us alone. So this is an abscess that goes into the jawbone. Right? You see the infection around the tooth. And again, it's hardly visible here. Most dentists would think that can be fixed with a root canal, but no, it's a chronic infection. It's spread into the jawbone, and there's nothing you can do other than pull the tooth. So for chronic infections, usually doesn't respond to the root canal. So if you've been holding off on treating a tooth and it's been a couple of years, I would probably gear more towards taking the tooth out and doing an implant because the infection is more widespread than you think on that X-ray. And then again, the exact opposite. If it's an acute infection, you just fell down, you broke your front tooth, and you know it's bleeding in the nerve and you need a root canal, the prognosis on that is excellent. Go with the root canal. So the longevity on the infection is one of the main things we consider because, you know, chronic infection, tooth is massively infected, generally doesn't respond well to the root canal, and the exact opposite. So that's the third thing you should consider is the type of infection, chronic versus acute. Guys, the fourth thing to consider when you decide between a root canal and dental implant is your previous luck with root canals. What does that mean? Well, it's actually quite simple. I have patients that have had root canals, and a lot of you out there do. And the question is how well your root canals have held up over time. Do you have a lot of root canals that are just holding up and maybe no failures, or maybe one here and there, or are every single one of your root canals just kind of falling apart? Let's go ahead and look at an X-ray to make better sense of it. So this patient here, right? She has 1, 2, 3, 4, I think 4 or 5 root canals, but they're all beautiful root canals. She hasn't had a single issue with a root canal, and you know, she's a senior citizen patient. So if this patient comes and she has yet another bad tooth, we're going to gear towards doing another root canal because she's had tremendous luck with root canals, and that is the way to go for her. Then you have this patient. Broken root canal, broken root canal, broken root canal. These weren't broken, but they're also broken now. This is from a couple years ago. So the patient's batting 0 for 7. So, you know, or something close to that. So hasn't worked out for this patient. Now, the question that a lot of you are having is, why is this the case? Of course, this patient has to get implants. You don't want to do a root canal. You want to stay away from root canals like it's the plague in this particular case, right? You know, that's hard to answer. There's a lot of different factors that come in. As you notice, the first patient had all of her teeth and she has better hygiene. Second patient has poorer hygiene. Plus, in this particular situation, we have a lot of missing teeth, which puts stress, which causes your teeth to break. But a combination of just bad luck, bad bite, and also some people just have weaker teeth. You know, your enamel, your tooth structure is weaker. So whenever you do a root canal, you remove the nerve, but you also remove the blood flow to the tooth. So the tooth gets even weaker. And if you're already starting with weak, fragile teeth, doing a root canal isn't gonna do you any favor. So that's another contributing factor. But I mean, how do you know you have weak teeth or strong teeth, right? Get your vitamins and be healthy, guys, so you don't end up in a situation where you have to pull a bunch of teeth. But yeah, your previous history is a huge indicator. And when patients come to me, you had a lot of good root canals, let's try the root canal one more time. You've had a lot of failing root canals, don't even think about not a root canal. So, you know, and for those of you out there who understand what I'm saying, you know what I'm saying, right? Your root canals work, keep going that route. But if they're just not working out, just cut your losses and start doing implants. And if your dentist is refusing to do it, go find somebody who's going to do it for you. Because, I mean, you know, you don't want to just keep making the same mistake, right? So you got to judge it. But again, because of the quality of the teeth, the quality of the bite, and sometimes it's just the fillings you had. You know, some of these patients where the root canals failed, they had really big fillings that were removed. There wasn't a lot of tooth structure, so the root canals start failing one after another. But yeah, your previous luck with root canals is a huge indicator. And patients who've had great luck with root canals should try to stick with root canals. Patients who've had a lot of root canals fail on them should avoid root canals and gear towards dental implants. Guys, the fifth factor that determines whether or not you should do a root canal or avoid a root canal is the quality of the work. And believe me, that makes a huge difference, okay? What are we talking about? We're talking about the quality of the root canal and the quality of the buildup and the crown, all right? There's a couple things that goes into saving the tooth. And, you know, the dexterity and your dentist skill level is a huge determining factor. I mean, there are teeth that get infected and they need root canals. And I mean, I'll show you guys a model of a root canal just so you get a better idea. You know, a root canal is we remove the nerve, we cut the tooth, and then we put a crown on top of it, right, as such. Of course, this is simplifying it. So to do a root canal, all that nerve needs to be removed and replaced with gutta percha. But teeth have multiple nerves, and each nerve has a certain length, and you need to clean all of it, irrigate it, disinfect it, and put that filling known as a gutta percha all the way to the end. So the quality of a root canal makes a huge determining factor. If you get a poor quality root canal, your dentist doesn't do a lot of root canals, they're not very good at it, or they just don't do a good job, your chances of that root canal failing is pretty high. The next step is the crown, right? When you get a root canal, you usually have to put a crown to stabilize the tooth. It's another thing that your dentist skill is a huge determining factor. If your dentist is very good, puts a strong post, builds it up really nicely, trims as little tooth as possible, and leaves maximum amount of original tooth structure intact. Those little things all add up, and the quality of the work is going to be a determining factor. If you do a shoddy job, the chance of failure is high, but if you do a good job, the chances of success is higher. And a lot of times you may have to go see a root canal specialist known as an endodontist. And when you're doing crowns, you have to opt for the better crowns. The better crowns are made from one-piece ceramic. They're skinnier than the cheaper crowns, the PFM, so we have to shave less tooth structure to make the nicer crowns, which basically means nicer crowns also do less damage to the tooth, thus increasing the longevity of the tooth. So all those little things add up. So if your tooth is important to you, don't try to cut costs. You know, you want to do it the right way, and if it takes a while and you go to a root canal specialist and your doctor, you know, charges you for those upgraded crowns, I mean, that's what it takes, because the difference between a poor quality and a high quality is going to be a determining factor in whether or not your root canal is going to stand the test of time and last 2 years, 10 years, or 20 plus years. Okay, guys? So pay attention to the quality of work, go to a good dentist, and do the right thing if you're planning on saving the tooth, because that is one of the major factors. That's the fifth important thing when it comes to saving the tooth. Okay, guys, let's share my final thoughts with you. Root canals or implants? Well, I do both of them, you know, and I look at all those factors when I decide which one I'm going to do for the patients. Usually when I get a younger patient where the tooth is still in good shape and it's not a chronic infection, I do the root canal. Then exact opposite. If I get an older patient, the tooth is in really bad shape and it's been worked on many, many times, I do an implant. It's that simple, okay? But of course, you have to understand everything I said. You have to take all of those and try to kind of look at every single factor when you're making this decision. Because you know what? Usually, if you haven't watched my video, then you're gonna say, well, which one's cheaper, root canal? Okay, yeah, I agree. Root canal is usually cheaper. But first of all, there's the root canal post and crown and sometimes build up. So it's not that much cheaper. And second of all, if the work's gonna fail in 2 years, who cares? I mean, why are you thinking about money when you should thinking about longevity? So you wanna make this decision based on the prognosis of the tooth. If the tooth has a high prognosis, 80–90% chance of lasting 5+ years, then go with the root canal. I know that it's not perfect. A lot of you wanna hear 100% chance of lasting 25 years. Not gonna happen. I mean, even implants can't fit. But yeah, if it has a really high chance of lasting 5+ years, then go with a root canal. If the prognosis is guarded, if the dentist is like, oh, well, I think it'll last 2 or 3 years, you know, maybe not, then yeah, you probably want to go with implant. I mean, I'm in California, so, you know, dentist work has to last 1 year, which is really nothing. Otherwise, you're pretty much on your own. So if you do a root canal and it fails 1.5 years later, I mean, it's a sad situation, but you know, there's no refunds usually. I mean, that's just how California law is. So you don't want to think just money when you're making this decision at all, guys. Trust me. You want to think about longevity. I mean, is this a good candidate for root canal? If it is, then yeah, save the money, save the headaches, do the root canal. But if it's really, really guarded and it's just not looking good, why spend that extra time and money and doing it twice? Just spend the bigger bucks and get rid of it and do an implant. Because implant has a higher prognosis than root canals anyways. I mean, implant prognosis is 95%, and you know, and root canal prognosis is like 80%. So implant is a little bit more better, but it's also a lot more expensive. So when you're making that decision, consider all the factors that I went over. Okay, if you guys have any questions or if you want me to assist individual x-rays, you know what to do. Put them in the comments below and I'll get back to you guys. But yeah, that's how you want to go about it. Now, if you don't know what a root canal is, guys, check out my video up front and I'll explain to you what a root canal is. If you don't know what a dental implant is, guys, check out the video up front and I'll explain to you what it is. But I'm assuming for the purposes of this video, you kind of done your research and now you're trying to decide between A or B, root canal or implant. And that's why I got very detailed in my video. I hope your brain's not on fire like my mouth is. Let's see, do I have anything else to go over? I want to share my story. So when I was in my 20s, this dentist did some shoddy big fillings. They broke and then I had to get a couple root canals, 3 of them. And you know, 15 years later, 2 of them ended up getting infected and I had to take them out. So I went from 3 root canals to 2 implants. I'm a dentist, right? Good luck, guys, if this happened to me. But anyways, that's not the point. Now, the question is, so I got root canals from my 20 till mid-30s. Was it worth it? I mean, you know what? Frankly, it was. Because what was I going to do? Pull those 2 teeth when I'm a 20-year-old with no money, no time to fix my mouth? Or just do the root canal and buy myself that 15 years. And then, you know, now I'm in a position where I can do an implant. And then I did the implant. So sometimes a root canal just buys you time to get implants. And on younger folks, that's okay. I mean, you know, I may have gotten lucky. One of my root canals is still doing pretty good and I've kept it. But then the other 2, you know, about 15 years, they started getting infected. And I elected to take them out because they were causing problems. But yeah, sometimes root canals aren't permanent, but what is? We're not permanent, so why should your root canal be permanent? Implant sometimes fails too, although the chances of that is a lot less. But yeah, the root canal, even if it's a bridge towards doing the implant, a lot of times it works well for younger folks because, you know, they can afford it. It's not as much headache. It's a quicker process and it's a better option at those points. So that's pretty much it, guys, in terms of comparing a root canal to a dental implant, which I know at the beginning it sounded like comparing apples and oranges. But yeah, that is a dilemma that a lot of people have. And I hope what I did today was enough to help at least guide you in the right direction, okay? So yeah, I hope you enjoyed my video. Be sure to check out my other videos and subscribe, guys, and I'll see you guys in my next video.